Hello. David.
Alright, just gonna give an insulin here. There we go.
Thank you.
Yeah, you're welcome.
Hi, Helen. How are you doing? Well, today I went to go to the lawyer's office to find out, well, information pretty much. I want to see how much it was going to cost and everything. It's like $350 per hour. I mean, they do sort of time it differently. So let's say we would talk on the phone for 6 minutes, they would only charge me for 6 minutes, things like that. So I didn't, and they wanted $1,000 down right away. So I said I'm gonna think about it, but overall I will be going to do it anyways. They said that it would cost roughly about $2,000 to $5,000, but then it can become difficult after, because it all depends if they have a hard time finding, like, getting in touch with the doctors, then it could go up more. It can go to 5 to 7 to 8 to 9. Excellent. Like I was just saying, and I'll just ask him how high. He said it can go as high as whatever, and he said that also is if say it goes to $10,000 or something to do this process, because of the fact that I don't think it will, but because of waiting on doctors and calling and trying to chase after doctors to get information. He said that if I were to stop it because I wouldn't be able to afford the funds to do it, then I would still have to pay them and get nothing in return. You get nothing. So I'm sort of like thinking about it and seeing how, I think it should work out, I'm hoping. Charles is no longer on oxygen anymore, so he's breathing on his own. It's been since yesterday. So that was a little bit of a rough day, sleeping here. I mean, I've been watching him every 2 seconds, making sure. And now they don't even have the oxygen level reader to know that if he's at 92 or 88 or whatever. I mean, we don't have that anymore, so it sort of got me a bit nervous on that factor. And then the nurse was saying is that, how you can tell is if his lip starts to go blue. If his lip starts to go blue, then, to ring the bell, and yeah, exactly. Yes. Also, we had a meeting at the hospital for Charles's discharge, getting discharged from the hospital. I mean, it's not like it's happening now, but it'll be happening, like, we're not sure exactly, but it was having the discussion. So the discussion is like, is he going to stay at my house? Is he going to live in a home-like type thing? If he's in a home, then they will be taking 80% of his salary, which is probably around $3,800 a month, but he would get the care that he needs. Or he will be coming to stay at our place right now. We were thinking of moving, but I don't know if we will. So if he comes to our place, then I'll be the person to take care of him. I'll be getting paid from the government or something to take care of him 7 days a week, 24 hours a day. I also will have nurses to come in as well. But it was talked about that. Also, I mean, because he's on tube feed, and BC doesn't cover that, so that'll be $800 a month for his 2 feet. And then they started talking about like his bed, because his hospital bed, they said it's between $15,000 and $25,000 for that. And then if he needs a wheelchair thing, especially for him, that's another $15,000 for that. But they also said that I might be able to get one for 6 months where I wouldn't have to pay, and which would be good, I guess. And I'm also thinking about maybe paying per month or something, either renting to own or just renting. I'm not sure. So it'd be a little bit cheaper. But overall, Charles seems to be doing well, except for today. Like I said, he's on a pig feed, and I don't know why, but he ended up having like a bowel movement, but mucus type thing. It was like a mucusy bowel movement, which was strange. It happened twice today, one earlier, and I just found out today because I was checking him to make sure to see if you need changing and stuff, and I saw that I didn't even know what that was. And I was just hoping that it was caused from the pig food. I don't know. I really hope that he's not having a digestive or something problem. I mean, that's all I need. I spoke to the new doctor today. He was young, I don't know, 20-ish, I'm guessing, but just like all the rest, it seems like. I mean, we had a long conversation, but he ended up mentioning something about like, we have people that if their loved ones are, we can help them pass and this and that, or we can help them be comfortable, or they can go in hospice. I'm like, what's up with all these people and talking about all this stuff? I mean, I've been hearing it from day one. Sorry, I've spit it a little. Day one, right? Oh, where? The shower beds and stuff? Sorry, I'm not reading it. Yeah, but hospice is for someone that's passing away, ready to pass, right? I mean, the doctor did mention something about hospice and stuff, but I don't want to put Charles in hospice because hospice is where you're ready to pass, and he's not ready to do that. You know what I mean? Oh, can it? Oh, sorry. I didn't know that. I just always thought it was for um, someone passing. Okay. Sorry, I didn't know that, but thank you. Overall, I really want Charles to come home and stay with me and look after him and take care of him. That's actually really good information. I didn't know that. But I mean, when they were talking about hospice, they were like, oh, we can go to hospice. We could take him off all his medications and find something to relax him and make him feel comfortable and things like that. So they made it out like it was like a sentence, you know what I mean, or something. Oh, I'm sorry to hear. How is he? How is he or she doing? I mean, it's such a crazy, like, hard journey. I mean, I thought it would be a little bit easier, like, dealing with the hospital and stuff, but it's not. It seems to be, like, just worse at times. I mean, just sad the way that it works. I mean, we did talk about in the meeting that, like, they were mentioning how are you going to rotate him every 2 hours and things like that when he lives with you? And I was like, I told him, I said, well, you don't rotate at the hospital every 2 hours. And they're like, they don't. I go, no, I mean, one of the days Charles was here and he didn't get rotated for 7 hours. Also, the day before that, another 7 hours. Sometimes 5 hours, sometimes 4 hours, sometimes, you know what I mean? He's never really got it rotated every 2 hours since I've been here. And I stay overnight and I stay until like 3 or something in the afternoon. So, and also, I mean, I feel bad sometimes leaving because when I come back, like I came back today, I mean, nothing against, but I mean, he had all his mouth was all foamy and stuff, like he was bringing up secretions, and it was suctioning out so much stuff from out of his mouth. You know what I mean? Things like that, you know. Also, I mean, for them to take the oxygen thing off his finger, and I'm worried, like, I mean, you know, what if no one comes in and he's not breathing? You know what I mean? Because with the oxygen thing on his finger, they could check it on the monitor outside and see. But if he doesn't have it on, they won't know. I mean, thank you. And I'm glad to hear that he's doing well, hanging in there. It's nice to hear. So true. I mean, so true. And just like this doctor, I don't know, it's like he was programmed like a robot or something. Why do they want to take him off? Take him off what, sorry? So, I mean, today he was doing quite well. I mean, I did a lot of suctioning. He brought up a lot of stuff, which is good on his own. And then all of a sudden, he had that mucus poop thing. And now I'm like, I don't know if it's mucus, but it's probably something that one of the nurses was saying that maybe he's not digesting the food. So I don't know. I don't know. But then another nurse said it could be just because of the fact of being on that food. Sometimes it may happen. So, yeah. Yeah. No, I don't know why. They were saying that it's because his chest is good. Like, he doesn't have mucusy things and stuff like that. I really don't even know. I even said that, like, the girl took it off during the day. And then I'm like, okay, fine, because I'm here. But I was still nervous about it. And then all of a sudden she said, well, for your comfort, I'll put it back on when you come in. And they don't have it on, and they still don't have it on. I mean, I don't know. Sometimes. Just when you think that you're having a good day, then something else happens. I'm not trying to get too stressed about it, but I mean, I was really stressed about with the doctor. I mean, I'm sort of getting used to it, which is pretty sad, but here, hold on. I can just reverse it. So. But I mean, oh, oops, it switched over. But also, I'm saying to myself, it's like, imagine if I wasn't here. I mean, every day, the day that I'm here, like I'm here so much, and I go home for a few hours. I mean, imagine if I wasn't here. I mean, I don't know. Would he still be here? You know what I mean? In ways. Because I do all the suctioning, I stay up, I keep an eye on his monitor, I raise his bed so that way it helps with his his breathing. It's better when it sits up. I mean, I put cold presses, hot presses on his knees. I mean, and the thing is that a lot of times, like the nurses, don't get me wrong, I mean, fabulous nurses, there are fabulous doctors too. I mean, I've got 2 fabulous doctors here and 1 in Kelowna. I got a lot of fabulous nurses, which is good. I mean, I had one that gave me attitude when one of the Yonkers like fell on the floor when they were changing him, and I went out to go and ask for a new one. And when I went out, she was like, I forget, what do you want, or something like that. And I was like, oh, Charles's Yonker was on the floor. Can I have a new one? She's like, okay. I mean, I don't know. It's just so hard as it is already, you know what I mean? Dealing with a loved one in a hospital. I mean, then to go on top of it, to go through all the other things. I mean, and then like with work too, I had so many issues with work, fighting and with work and stuff. I mean, I'm still applying for EI. I mean, I just finished applying it for it, but they're asking for another paper, so I have to do that. I think they want a marriage certificate as well or something. I mean, it's just crazy. Oh my God, seriously? Complain because he went to the bathroom? I mean, that's crazy. And I mean, the doctor, when he was here, we're having such a huge conversation. We had a huge conversation. I told him, I said that, you know what I mean? First of all, I mean, they don't rotate him every 2 hours. I have to suction him. I have to do this. I have to do that. It's like, I did say it's like, I don't work here, you know what I mean? You know what I mean? And I'm here majority of the time doing most of the stuff. I mean, some nurses will come in and just give him his meds and not suction him or not whatever. And then they're starting to show me how to use the other machines, right? So I'm wondering if, you know what I mean? Because I know how to change the feeding tube and all that stuff and put new, replacing it and everything. So I know all that. I knew it before. It's just been a while that I haven't done it. Yes, it's true. He is fighting, and I totally do. I mean, today when I gave him a kiss and I was like saying I love you, and I mean I swear I don't know if it was my ears, but he didn't. He's like I heard him say love you, but not in his voice. It was sort of, I don't know. It could have been just me, but I'm thinking that he did. I always say when I heard it, I was like, "What are you doing? Are you saving your voice or what? Can you really already talk?" Because he can't talk. He hasn't talked. I mean, the doctor was telling me, he goes like this to me, he goes, oh, you know that Charles is on basically like life support. I go, what do you mean? He goes, he's on machines to support his life. I go, he's on a feeding tube. I mean, to feed him. He goes, yeah, that's supporting his life. I go, yeah, in a way it is, but there's so many people that live their lives on a feeding tube, right? I mean, there's, you know what I mean? It was just strange and weird, and almost like he seemed so like a computer or some sort of robot or something. It was just weird. I don't know. But anyways, like I said, I take like a small percentage of what they say, you know what I mean? Yes, I mean, yeah. The funny thing is that one of the I probably talked about it before, but the nurse came, not the nurse, the doctor came in and she was talking right in the room, and he was there, and she was talking about all these things and saying about maybe taking him off meds and this and that and the whole bull whatever that they always talk about. And then she went to go over and try to see if she can get him to answer questions through his hand, and he never answered her, right? And she's like, oh, he doesn't answer. I go, yeah, he does. Maybe not now. He didn't. When she left, I went and grabbed his hand. I asked him, I go, did you, like, I was like, did you purposely not answer her? Squeeze for yes. And he squeezed for yes. And I said, do you like her? I said, squeeze for, you know what I mean, if you like her, if you don't like her, for no. And he squeezed. And it was just funny. Yeah, I mean, I know. That's why I know. That's why I was telling the doctors and everything like that to stop talking in the room when they start talking all this crap, right? Because I mean, I tell them that they can hear him all the time. Like he can hear everything, and that's what I did too. Because I was holding his hand. I was like telling him, okay, I'm gonna be working on trying to get a rental property and move from where we are, and we'll stay there for a year, or we could stay at the house that we are in and stay there for 6 or 7 months and then move and purchase a house. And it said, I go, does that sound good? And I said, yes. So yeah. Yeah, he did. It was funny. It was funny, seriously. Yeah. That was funny. Mm. He's still a little character. Yeah. I mean, mm. I mean, there's still a lot of steps. Like, the good thing is that, like, he also, I got afraid, man, because I mean, they did a COVID test again, and then all of a sudden I come and there's a sign where you have to wear mask gowns and everything. Like, you still have to wear a mask, but I mean, the shield and all the stuff and everything again. I'm like, what, does he have COVID again? And then I found out that it was basically like they did take a COVID test, but with COVID test, there's a bunch of other things in it. So they want to narrow down things to try to find out exactly what was wrong. Because he ended up getting a blood infection again. So that's why he's on meds again for that. But he didn't have COVID, which is good. I mean, I'm so happy to hear that. He does sleep a lot, which is good, but they also give him a lot of pain medications and things like that. I mean, they give it to him every 4 hours, but I told him maybe you should be giving it as needed, you know what I mean? And there were times where when they were rotating him because of his knees and stuff, and I said, well, maybe you should give him, I think it's Dilaudid, I'm not sure if that was the word, but maybe you should give that first before moving him, knowing that he gets in pain when he does move. And they give him a Tylenol and then move him. And then he's like freaking, like breathing so heavy and so fast and so this. And it was just, you know what I mean? And then after that, okay, and then they gave it to him through the needle again. So he had to wait another 20 minutes. Yeah. Ready? Come on, it's okay. There we go. Get it out. Ready? Any more? No more? Let me try in the little pocket just to see. You got a lot there. There we go. But there was a time where I was suctioning so much because you know when you get so nervous and you're just like, I was just suctioning him on way too much and he got all pissed off and he was like bit on, like held it and didn't let it go. And then after that, he just didn't open his mouth anymore. I was sort of like, then I learned, now I sort of like ask him a bit. Thank you, grumpy wife, Lisa. I really appreciate it. Have a good night too as well. Thank you very much for popping in. I really do appreciate it. I'm gonna get off here too. I just want to touch base, but yeah, a lot's been going on, but a lot of good things. But you know, I'm just sort of looking forward to him, Charles, coming home because I mean, there's so many bugs and so many things in the hospital that you can catch. And the doctor, they were saying is that